Late Night Health continues. Our guest is Dr. Shosh. We're talking about new tools for new moms to beat postpartum depression. 1 in 7 women who give birth have this problem. It's a disorder. It's more common than diabetes, Dr. Shosh was telling us before the break. That happens often when women, I guess, gain a lot of extra weight and after the baby is born, actually even during pregnancy.
That's right. It's the most common complication of childbearing. So, and it's so odd that it's not screened for on a regular basis. That's what really needs to happen. And OBs, midwives, doulas, even daycare operators, preschool teachers. Everybody doesn't have to be an MD, or a medical practitioner. Does anyone in contact needs to hand out information on a regular basis? You can't count on knowing if a mom is depressed by looking at her. She might be dressed perfect. She might have makeup on. She might be smiling at you. You don't know unless you ask and unless she has the information in her hands to know what to do if she feels, anxious or has appetite problems or insomnia or she's crying frequently or she's feeling completely overwhelmed or angry for no reason at all. Or, these kinds of things can really get in the way of her life without you seeing it. So it's very important she has something in her hands, so she knows what to do. She knows who to call, so that she can get on her feet.
But don't most people say, "I'm just feeling bad," and this is men and women regarding depression, doctor. Don't they say, "I can do this myself. I don't need help"?
Sure. Well, again, there's a lot of shame, especially with postpartum depression, because, the myth is that if you were a good mother, you could handle everything and you'd be fine, and this is some kind of a weakness and you're inadequate or, there's something less than about you, right? So what she needs to know, and why I'm so grateful to be on your show, is to be so that people know, the public knows that there's no shame that should be associated with postpartum depression. This hits indiscriminately to the best of us,
as mental health in general.
Absolutely. But again, when you have a baby there and you feel unable to really be there for the baby and feel like you want to feel towards the baby or whatever's going on, there's that extra layer. You're not only having difficulty taking care of yourself, often you're having a lot of difficulty taking care of the little one. And mothers are notorious for being hard on themselves to begin with. But you add that layer to it, a clinical disorder, and it's like 100-fold,
Have either of your children gone into the healthcare profession?
No, one's a realtor and one's a massage therapist. So I think they're staying the heck away from it, frankly.
Well, the massage therapist is something that could help.
Oh, certainly. And they're both big healers in their own way, if you know what I mean.
Sure.
But no, not the profession itself.
Yeah, neither of my kids are either, because one of them is needle phobic, and the other one doesn't want to touch people, so wouldn't work. How does the therapy work over the phone or on the internet with a webcam?
It works exactly the same as if you were in person, and often even better, frankly.
Why better?
Well, sometimes what I hear from my clients over the years, even those that were skeptical to start with, what they'll say is, I'm so much more relaxed, as much as you can relax with a postpartum depression. But they'll say I'm so much more comfortable in my jammies, curled up in my bed, just kind of dumping my heart out to you, rather than being stressed out, getting on the road and driving and finding parking and finding a babysitter. I mean, I would have been so rattled. I don't think I would have told you half of this stuff.
Dr. Shosh, you are terrific. We really appreciate your being here. Listen, look for Dr. Shosh's movie, darksideofthefullmoon.com. darksideofthefullmoon.com, and you can also go to drshosh.com. Go to latenighthealth.com And you'll see a very, very pretty picture of Dr. Shosh and all of her information and contact information as well. Dr. Shosh, thanks for joining us today. We look forward to talking to you again sometime
I'd love that. Thanks so much.
Thank you.
Bye-bye.
Thank you very much for joining us on Late Night Health. We wish you a very good week, a happy week, and of course, most importantly, a healthy week. We'll see you on our next show. Thanks a lot.